Welcome to the IBS Freedom Podcast. We are back. I mean, like, it's all the same to you, right?
I know.
So Amy and I took 2 weeks off because I had had my ear surgery. But to you good people at home, we successfully made it so that there was no lapse in IBS Freedom Podcast uploads. High five, Amy. High five for us for batching some content ahead of time. Go us. Today, we're going to be talking about antibiotics. Lots of different things to talk about within this conversation. When it might be appropriate to take them, when it might be appropriate to avoid them, acknowledging neither of us are prescribers, neither of us are medical doctors, et cetera, et cetera. But, you know, that piece of it, the effect on the microbiome, the effect on things like candida, like there's all sorts of fun stuff we're going to cover. But first, selfishly, I had proposed since we like built you listeners up talking about, or at least mentioning my surgery, I figured I would let everybody know it went fine. As far as I can tell, can't hear a blessed thing out of this one ear. Actually, that's a lie. I told Amy before we logged on, I could hear bass for the first time pretty much ever. So I'm experiencing music in a whole new way. But other than that, I'm not hearing very much out of that ear. My post-op appointment is next week, so I'll know a bit more then. And they have to like suck out the goo and
Oh, God.
So
Actually, though, like I used to go to the ENT because, I mean, this is kind of gross, but I have waxy ears. My dad does too. And like he'll go to the ENT like every so often just to like suck out some of the wax.
Mm-hmm.
But sometimes like that feels kind of good. I don't know. I'm like maybe in that subset of like, ooh, something like feels cleaner in there.
They have entire videos of that on the internet, just so you know. Actually, the Try Guys did a video where like they all went to an ear doctor and they all had their earwax cleaned out. And oh
my God.
Man, one of their staff people had like the biggest chunk. Like it was fully blocked.
Yeah, like doesn't that feel so satisfying to like suck that out? Maybe I'm the weirdo too that likes like popping pimples too. I don't know. Like I'm the weirdo that kind of like
and sniffing hair salons.
Sniffing hair salons, like that kind of thing.
Well, I will say I can understand how that would feel good. And like, you know, it's kind of like when you go to the dentist and you're like, oh, my teeth are so clean. And like,
right.
You
like how dirty
this.
Must have my teeth been before that they all of a sudden feel so clean.
Yeah. And you're like, I could feel each and every tooth now.
Right.
So I get that it's kind of the equivalent of that, but for your ears. But I think for me, because I had had so many procedures and so many appointments all of my childhood, I think it's like kind of a PTSD-ish thing for me, where it's like all of that like scariness from my childhood is coming back up. And also, I don't know, this might be TMI. I'm going to raise your TMI moment with another TMI moment. I don't understand how people think it feels good because I have determined, I think part of the problem is like the little hairs in there get like stuck on the wax. So I'm basically giving myself a bikini wax, but inside my ear canal. Like, I think that's part of the problem because when I go in there with like my little camera and look around, I definitely see like some little baby hairs. Not anything crazy, like, you know.
I love you going into your own ear. Like to me, like I don't know, just the weird image that comes to my head is like when they're looking for the Titanic and they're in that little tiny like I don't know, submarine where they're like going around the Titanic. That's how it is when you like go into your ear. Like you're going the deep abyss of your ear
Maybe a little
with
bit.
your little camera to like look around.
But what's weird is you could buy that camera on Amazon for like $20. There are numerous versions of it, but it's like a pen. It's like a pen light.
Right.
It's got the light and the camera at the tip of what looks like a pen, and you just like stick that in your ear and look around. Yeah, it is a bizarre thing that I have that tool. But yeah, it's I can't see anything in there right now because again, it's all like clogged up with debris at the moment. But next week he's gonna like suck all of it out. Ugh. And I'm not looking forward to that.
Oh my God.
I already told him like the last time I went in, I had him put in an order for Valium, and I literally took a benzo for the first time in my entire life for an ear cleaning appointment.
Woo, party up.
I don't know if it did anything, honestly. I didn't feel that much different, but I did make it through the appointment. So maybe.
Right.
But I've already, like, we agreed, like, oh no, you're going to need it for this appointment. So
Right. Like, again, like, even if it's hard to know how you would feel at baseline while you were on the benzo. Like, again, it could have calmed things down. It just wasn't super obvious. Where you were, like, kind of delirious, which you probably wouldn't want anyway. Like,
I feel like what it did for me personally was, like, I don't think it altered my, like, baseline functioning. I think what it did was it kind of, like, put a cap on the ceiling of how high, like, my nervous system could get revved up.
right.
If that makes sense. So it's like, I think had I not had that appointment and I took that one dose, I don't think I would have noticed at all. But the fact that I made it through the appointment indicates that I think it, like, put a cap on what I might have experienced as far as, like, nervous system dysregulation. Anyway,
Right.
I'm going to do it again because I'm dreading the post-op appointment. But I'll show you something kind of funny and kind of weird. I think I told you this. So I prepared out the wazoo for this because this was not my first rodeo. This was my fourth of this particular procedure. So I remembered, like, okay, no straws. I'm not going to want to open my mouth really wide because, like, the TMJ is right there and that's going to
Right.
feel weird. And, like, I'm probably not going to want to do anything. So I made myself couch nest. I remembered I'm not going to want to, like, crunch a lot of stuff. So I basically ate, like, soup and lasagna and, like, lentils and rice for the first week or two.
Right.
So I had a lot of, like, soft foods. I had this all planned out. You know, the basic thing that I completely forgot until we were at the hospital in the recovery room?
What's that?
I forgot that I am a glasses wearer.
Oh, yeah.
And the scar, the incision for said surgery is behind my ear, where the little arm of the eyeglasses would go. And when you're fresh out of post-op, they put basically a plastic bowl on your head that's full of gauze and cotton balls, and they strap that onto your head. So there's no way to get glasses on. So I was in, like, the recovery area. I was, like, doing this, trying to look at people.
Oh, my
'Cause I'm
God.
so blind without my glasses. I'm so blind, Amy. So I was doing this, and then I was like, oh, that kind of is weird. So then I was, like, trying to hold it like this so that the lenses were correct. So
What's your
Mike was-
prescription, by the way?
Oh, it's strong. It's strong. I don't know.
know
Do you
what
wear
it is?
contacts ever?
I do.
Because all I know is the number on the contact
Yeah, what's your number on the contact?
package. Okay, first, can we make fun of Mixmaster Mike? Mixmaster Mike would totally survive without his spectacles if he needed to, like, in an end of the world situation, because
Right.
his is like negative 1.5.
Oh my God, right.
I know. And it's like, oh, you precious thing.
Right.
My prescription is like negative 5.5 and negative 7.5.
Whoa, so mine
two
is
eyeballs.
negative 5.25 in my right eye
Okay.
and
Oh, our right eyes
negative
are twins.
4.75 in my left.
Okay.
So my left is
lefty
picking up
is
the
one
slack.
that's, yeah, it's my left eye that's negative
know-
7 something.
You are legally blind then in both eyes. Because I think negative 5 and below, I think, is legally blind. Or at least that's what my brother told me. He could be wrong.
Oh my
but
God, I'm gonna have to look that up. This is reminiscent of the time I told one of my best friends that if she was 2 inches shorter, she would need a booster seat, according to the Disney commercial that I saw on the TV once.
Oh my gosh.
Because it was like 4'9" and below.
Right.
The more you know. And
Right.
I was like, Ruby, you're 4'11". Oh my God, you're this close, literally this close. But anyway, so I was kind of like doing the monocle thing and like trying to look through my glasses
Right.
in the hospital. And Mike is like, this is just ridiculous. I can't believe we didn't think of this. So I just didn't wear glasses like the whole way home. Obviously, thank God I had a designated driver. But when we got home, Mike did something for me. And I want to declare right now, I'm claiming this as my own. If you see this on the TikToks and the Snapchats and whatever whatever apps the youngins are using now, I know they like to steal things. They're like bringing Jinko jeans back. They're bringing all sorts of weird fashion from the 90s back. If somebody steals this and claims it as their own, we're going to whack it with a lawsuit because this is my thing. I'm the fashionista. I'm the trendsetter. You ready for this? I am rocking one-armed glasses right now.
Excellent.
So Mike just straight up took one arm off my glasses, and I'm wearing the one-armed glasses these days, which mostly is fine and you wouldn't notice. But also, if you look down whatsoever, they immediately just fly off your face.
Right.
And sometimes, like, I didn't realize how much I push up my glasses just like with one hand like this,
Right.
but then they're moving. I don't know if you can see, they're going like
Right.
this.
You get a little whopper
Anytime
jaw.
yeah, so I'm kind of adjusting my glasses like an old lady right now, and I'm doing like the two-handed, like, kind of adjusting. So yes, that is one weird thing, and I'm gonna probably do that for a little while longer, at least until the swelling goes down a bit on that side. Last hurrah, and then we'll talk about antibiotics, I swear, is they freaking shaved a bunch of my hair around my ear. I know I complained to this about you already, but like, I'm rocking some sort of
Oh my gosh.
undershave look right now, and I'm not pleased. They did not do that when I had this procedure as a kid. I verified with my parents, and they did not do this when I was a kid. And I was like,
I feel like it seems like a
hair
just
care.
for fun. It's like a just for fun shave. Why do they need to do it?
I mean, I kind of get it, but like that much? I feel like they could have gotten away with shaving a lot less.
I feel like though it could be a fun thing for like just to experience like the patch growing. You know, like Mom, can we check on the patch? And then she can give it a little
true.
lucky swipe.
I'm basically like a chia pet right now.
Yeah.
Chia.
Yeah.
Yeah. Oh my goodness. Well, those are officially all my updates now. So rocking the one headphone while we record this podcast. And hopefully there's no feedback from the other headphone that's thrown over my shoulder right now. But all of that aside, so I took the first 10 minutes of this podcast to update the people like I'm some sort of celebrity. Shall we talk about antibiotics? What do you want to open us with? No pressure whatsoever, by the way.
Yeah, I'd like to open it with just the idea that there's nuance here, because we work a lot in like the holistic functional space. And then again, like there's the conventional space, and I think there's sometimes weirdly so though sometimes like the functional medicine space can be a little bit antibiotic happy. At least in the SIBO space or like the gut pathogen space. But I think in general, like the holistic space is very like much apprehensive towards antibiotics, and more the conventional space still uses them a lot, and probably overuses them.
I feel like it depends on the training. I do agree with you. I think like we have the extremes of like chiropractors and herbalists and maybe nutritionists, maybe naturopaths, like the people who start out their path a bit more hippy dippy,
Right.
tend to be like really hardcore, like never, ever, 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 ever use antibiotics ever. They are the devil and they will kill. It's kind of like the scene in Mean Girls where he's like, don't have sex or you will get chlamydia and die.
Right.
Like, I feel like it's that with like the chiropractors especially, but like the more natural health professions.
Right.
But people who get into so-called functional medicine, but they started out their path going to medical school, like they're an MD or a DO or a nurse practitioner or a physician assistant, like those people, yeah, they might not use antibiotics for like acne, or they might not use antibiotics for like a cold or flu quite as readily, but they for some reason, all of them are brainwashed into thinking that they could treat dysbiosis with antibiotics, which just boggles my mind.
Right.
I don't understand.
When like every study and such is saying, it's going to create more dysbiosis. You're going to potentially lose strains of bugs that you might not get back. And I think I will say too, it's funny. I feel like you see some of the more extreme antibiotic resistant type behavior in like crunchy mom groups. I've definitely seen a lot of those where it's like, my kid has strep throat, like, what do I do? And then it's like, I don't know, like rub some essential oil, like throw some essential oils down there. Like it's like a frantic throw everything at it that's natural. And like to a sense, I like understand the apprehension there, but it's also like, if my kid had a case of strep throat that was pretty bad, like I definitely would take antibiotics, like,
Well, and this kind of segues into, I think, the conversation of like, where might it be appropriate to take antibiotics?
Right.
I think like we probably don't need to harp on the damage that these drugs can do, because I feel like a lot of our viewership already knows that. Like the people tuning in, if they hear antibiotics can mess with your gut microbiome, the people listening right now are not going to be like, what?
I know.
That's madness. Tell me more. Like, I think a lot of people understand that, especially if they have, presumably if they have IBS or SIBO or something, and they've been through this a bit. And obviously, like, if you wipe out all of the bacteria in your gut, funky stuff can grow, whether that's bad bacteria or yeast. A lot of people get yeast issues and like candida infections after antibiotic use.
Right.
And then, of course, there's some antibiotics that carry specific risks with them. So, like Cipro,
Oh God.
like the Cipro's family of drugs are known for spontaneous tendon rupture.
Yeah.
Among
Is that like,
other
isn't
issues.
that called like floxed?
Yeah, fluoxetine.
Yeah, but they say
Maybe-
like, oh,
I
you got
forget.
floxed if you had like a bad
Yeah,
reaction.
you've been floxed is what they say. I'm
Yeah.
not a prescriber, so I forget the names of all the drugs, but
Right.
I have a really good friend of mine from undergrad spontaneously ruptured her Achilles tendon in practice, and they think it was because she had taken Cipro.
Damn.
I don't know how you would prove that exactly, but it was just like really weird that happened, and that can't be coincidental. I think she had her appendix removed. Like she had appendicitis, had her appendix removed, and then they had her on Cipro after that. And then it was shortly after that that her Achilles ruptured, like in the middle of practice.
Oh my God.
I know. So anyway, so there are specific drugs with specific like bad stuff that can happen with them.
And I would say with Cipro, like, again, it was a big part of my experience. And it's probably similar to like what you were talking about where, I don't know, I feel like it's this urgent need to try to clear stuff out that I think can lead to you maybe resorting to antibiotics in that situation. And I'm not saying like something like Rifaximin could potentially be helpful. But, during my experience, Rifaximin, I mean, I'm trying to think if this was like 2014, might have been like 8 or 9 years ago when I was on my Cipro, when I took Cipro, because my chiropractor was like, I think you'd really benefit from like a course of antibiotics. This was like, I feel like when SIBO was really kind of getting popular, but like there was less understanding, like there was less. We knew that Rifaximin was probably the best antibiotic, but there still seemed to be like, oh, you can use other antibiotics and it'd be fine. Maybe it's not perfect. So I couldn't get a hold of Rifaximin. I don't think it was covered by insurance, and like, I don't know, something, we couldn't order it. It would have been like $1,800 or something ridiculous for me to do a course of Rifaximin. And I don't even know if my doctor would write the script, but my doctor's like, oh, we'll just do Cipro in combination with Flagyl, because there were, I guess, like some studies or something, and like my chiropractor's like, you're gonna feel amazing after you clear everything out. Like, and so it's like, whatever, I'm gonna
Bizarre to me that it's a chiropractor saying that, because again, usually they're the most hardcore anti-antibiotics.
Yeah, like we had tried, I think I did GI Synergy from Apex. Like, so we had tried some herbals, and like, weirdly, I do think I was like experiencing some benefit maybe like 5 weeks in. Like I had taken it for a period of time, and there were so many issues with my diet at that time. So like, who knows what was going on. But like, I was like, I don't know, like I'm still feeling bad. And like, instead of actually like looking at what I'm eating and like lifestyle and everything that could have been preventing progress, he was like, let's just like blast this thing even further. And again, Cipro comes on board, Flagyl comes on board. And again, total disruption. Probably, again, I would say set me back a while, because I got yeast, like you're describing, like, and it like came out in like my nail. Like I got like weird like nail yeast infections. I don't know how to describe it, but I'd get like little, that's really gross, but like little kind of like patches of yeast like on my nails or even on my toenails.
Huh.
And then again, I'd get like thrush. So it's like, it kind of just spiraled and became more out of control with some of the antibiotics. And I think it's like, to me, I'd be really skeptical of taking any antibiotics like outside of maybe rifaximin. And like, again, I definitely would not take Cipro for SIBO at all. So again, like there's certainly like more antibiotics that I think are better and less of bombs for the gut than like Cipro would be from a SIBO standpoint. So like if you were going to consider taking some antibiotics for SIBO, I would not take Cipro or like some of these broad spectrum like heavy hitters. Like it might be more, you're better off maybe sticking to the ones that are used more often for SIBO that are kind of more strictly to the gut. And at least rifaximin, again, it could certainly still affect some of the colon. You know, it's like hard to tell for sure. I feel like a lot of the information, it's bile activated, so it's supposed to like not get as much into the colon, but who knows? Like if someone has bile acid malabsorption, maybe it does get into the colon to some degree, but I think it's going to be way less of a systemic clear off than something like rifaximin would. So again, like I think, you know, like we were saying earlier, like I don't think antibiotics can really fix dysbiosis. Again, there could potentially be some benefit for people with taking like a rifaximin to like wipe the slate clean a little bit, like clear a little bit, do some pruning, and then kind of try to rebuild. But even that, again, like I don't necessarily think's needed in most cases. But again, like it is interesting that sometimes I'll see clients where it's like, oh, I'm taking like these super strong antibiotics for SIBO, and it's like, oh my God, like it's like, no, like
Please no.
Right, reel that back in, because it's like, oh my gosh, this could be creating bigger problems than it's solving.
Yeah. I wonder too, like another scenario I've seen more times than I thought I would is where people are like, yeah, I tried rifaximin and I didn't really feel any different. And then a little while later, I took it again and like it didn't really do much. And then I took it and it's like,
Right.
okay, whoa. Like,
Right.
I don't know if this is on like the patient end or the practitioner end. Because I do think conventional GI, oftentimes they either just straight up don't believe in SIBO, or they're like, well, the testing totally sucks, so let's just treat empirically. Let's just give you rifaximin and see how you do.
Right.
And sometimes it becomes this game of like, oh, I'm just going to write you a script to get you out of my office.
Right.
Like, here, rifaximin. I only have one answer for SIBO. And you
Right.
think you still have SIBO, so I'm just going to give you that one answer, which is an antibiotic. But like rifaximin for SIBO as a conversation in itself, if it doesn't change your symptomology, if it doesn't make you feel any better, don't continue to take it. It's like that quote that's attributed to Einstein. I don't know if he really said it. We never know with internet quotes.
Right.
But like the bit about doing the same thing over and over again and expecting a different result is the definition of insanity. Like I could see giving it a try.
Right.
And then, you know, sometimes maybe the conversation is like, okay, we tried rifaximin by itself. Now let's try rifaximin plus like metronidazole and combining it with a different drug. Like I could maybe see doing that.
Right.
But beyond that, if you get to a point where you've tried it once or twice and you felt no different, like maybe it's just not going to help you probably.
Right.
But B, like maybe killing shit isn't your number one agenda item.
Right.
Right? Like just maybe the whole idea that you need to like kill and starve the SIBO is not correct for you as an individual, and you need to just move on from that whole idea and focus on other stuff.
Right. Well, and I think what I see happening a lot, and I usually tell people this who like are either new clients or like or kind of talking about their case, especially if they've done multi rounds of Rifaximin. One thing that I see often is, again, and I think antibiotics can be like this in general if you're sticking to the same one over and over again, but like a limiting rate of return with Rifaximin is huge. So like some of these GI docs just think, oh, just go on Rifaximin every 6 months. Like that'll be like the treatment for you because SIBO's chronic. And so like that's an idea, I think, in the GI space. And the problem with that is like even if it works the first time or two, usually what I see happening is like, oh, like then the third time, that didn't do anything. And again, maybe it's just that like you're having some resistance to it. Maybe it's just you're going a bridge too far and you're kind of creating like the benefit you're getting from doing a little bit of clearing is being outweighed by maybe some of the dysbiosis that the rifaximin's creating. So again, like there could be different scenarios for each person, but generally I see a limiting rate of return and a limiting benefits the more times you've done it. And sometimes again, like people do it so many times that like it actually becomes harm, like they actually notice negative effects from it, because it kind of goes like, oh my God, the clouds parted and the sun was shining for the first time in like 5 years when they first took it. So they're like, this is miraculous. And then it's like each time they take it, like the second time they're like, oh, it was pretty good still. Like maybe I got like 50% of the benefit I got the first time. And then like the third time it's like, oh, I didn't get much. And then they do it a fourth time just because like, oh, it was so good that first time. Like they're just clinging to the idea that I could just get to that first time feeling. And it's a big bummer because again, I could understand why like your brain would think, ooh, I just like need rifaximin again. But I think what I see happening, the people that do respond, again, eventually they don't if they do it enough times.
I agree. I think that the vast majority of people notice, even when the first time is stupendous, most people notice that it becomes less and less stupendous each time they take it.
Right.
Honestly, I can only think of one person that I've worked with over the years where like every time she did rifaximin, she felt just simply astonishing every single time. But this is a person who had taken it like 8 or 9 times.
Oh my God.
And it's like, ooh, like you're way overusing this. Like, I know it seems like a miracle to you, but I assure you it's not. And
right.
For her, stomach acid ended up being one of the biggest things. Like we got her on betaine HCl and it was like the miracle cure of miracle cures.
Right.
Which is interesting to like speculate, you know, was it the low stomach acid that was leading to dysbiosis or bacterial overgrowth? And then like both interventions ended up kind of treating the same thing, but one from a more holistic, safer, you know, angle, and one from like a much more aggressive, potentially harmful angle. Kind of interesting to speculate on that.
Yeah, well, and I think one probably treats more of a root breakdown.
Yeah.
Like versus just clearing things out. I will say too, another thing is that you could see happening is maybe you feel good on the rifaximin, but like the allotment of time that you feel good post decreases too. So I see that as well, where it's like, oh, I got like a good 4 months out of the first round. If you actually go to their website, I'll have to pull it up. I think it's something absurd. Like on average, the amount of weeks that people get benefit post rifaximin is 10 weeks, which is not very long. But it's on their website. Like I'm surprised they like are marketing it.
Yeah.
I put it in my SIBO program. I could double check, but I think it's around 10 weeks.
That is not super compelling.
Right. So again, like if you're thinking this is like, you have to do this, on average, again, they find that it provides 10 weeks of relief for, I believe, IBS D, or again, like, you know, more of a SIBO D situation. So again, like, you know,
you need to hide that statistic, guys.
Well, I know, it's so funny. It's like on their website, I have and there's like a calendar. Like again, they even have like a graphic for it, and I'm just like, that's not good. Like
their marketing department was like, this is excellent.
Right. So
Bless
Yeah,
their
but-
hearts. That's what I have to say as somebody who lives in the South now. Bless their hearts.
Yeah. But yeah, I think again, like, it's not that these things couldn't potentially be helpful. But I think it's really not going to help the underlying dysbiosis that there is with SIBO. And again, like, it could kind of do something. I almost, like, with my clients will sometimes say, like, if you're doing some clearing with an antibiotic, like, I'd almost think of it as it kind of like maybe like wipes the plate clean a little bit, but a lot of the composition still like remains the same. So like over time, I feel like, you're gonna like build back up a lot of the same composition you might have had before. Maybe there's some slight differences, but like from like an actual balance of the small intestines, you're not really doing anything. You're just kind of like decreasing numbers for a bit across the board, which could kind of make some room for some good guy. Like if you were going to do some rebuilding post that, which like a lot of people don't do. Yeah.
Especially when certain practitioners tell people that they need to be low FODMAP just indefinitely forever.
Right.
Becker.
Right. I think again, like at least sometimes I am seeing some docs again, like at least do PHGG in combination with Rifaximin. So you're at least like feeding. It's so funny too, because I specifically remember when like that study came out, like Pimentel was coming out and kind of saying like a fed bacteria is like an easy to kill bacteria. And I'm like, I don't really think that that's what's going on. Like, I think what's going on is that like you're actually feeding and able to preserve some of the good microbes.
Again, you just want to pinch his little cheeks and go, oh, you.
Right. But I remember like that was something I heard in multiple interviews from him was like, oh, like there's a basic line in, the GI world or something. Like he would talk about it in like such a way like, oh, everyone like knows that like a fed bacteria is an easy to kill bacteria. And I'm like,
then like, what have we all been doing then if it's like so widely known?
Well, it's just kind of funny because I'm like, I don't think that's the conclusion that I would like have from PHGG being helpful in combination with Rifaximin. I think it's more nuanced than that.
Well, I feel like the key is, and I wonder if they could try to prove or disprove this, is like, because Pimentel, aka Dr. Pimentel, remember, I once heard a human being honestly call him that, and now I can't get it out of my brain.
But now
sorry,
you keep
Dr.
saying that, and now
Pimentel.
I like have to like when I say it, I want to say Pimentel like instead of
It's
Pimentel.
just so amazing. Like, did you really think the man was named that? And have you never heard of SIBO? Like, have you never heard him lecture ever?
Well,
like,
it was
they'll
funny
introduce
because
him.
she was lecturing you on SIBO,
I
but
know.
then couldn't pronounce
know.
his name.
I know.
So
Don't get me started. She was building herself up to be an expert, which I'm pretty sure she is not an expert in. But anyway, that's a story for another day. We talked about that like way back in another podcast episode. Good luck finding the story. But anyway, Dr. Pimentel, I remember his whole shtick of like a fed bacteria is easier to kill, and like almost like painting the bacteria as dumb of like, oh, the bacteria is going to come out and like gobble up the food and then like accidentally gobble up the rifaximin at the same time.
Right.
Ha ha ha, we're tricking them. But which also like, I don't know if that makes a ton of sense, but what's interesting, I swear to God, they could prove this if they wanted to, because his research group is dead set right now from their current studies, the reimagined studies. They are dead set that the culprits in SIBO are E. coli and Klebsiella. That's pretty much the list in 99% of people, and he's singing it from the rooftops, which is very fascinating. I'm running with that research. I'm going to follow that assumption for the time being until other evidence comes along.
Right.
But you have two bacteria that you're implicating here. This is so easy. You get a bunch of Petri dishes and you put some E. coli on them. You get a bunch of Petri dishes and you put a bunch of Klebsiella on them. You put different food substrates. You could make this into a mega study and have it be deeply fascinating. You could have one that has some glucose on the plate, another one that has fructose on the plate, another one that has protein, another one that has fat, another one that has PHGG, inulin,
Right.
butyrate. Like you could culture these two bacteria with, pun intended, a shit ton of stuff, and you could see if anything inhibits or accelerates their growth and appears to feed them. Like this is like basic bee immunology kind of experiments. And again, like I would understand if they were saying like, oh, there's like 100 different bacteria that could be overgrown in SIBO.
Right.
Like that would be really exhausting to do that kind of research on 100 different bacteria, but it's literally 2.
Yeah.
You could do this. We have the manpower. You have the funding. You're famous enough. Just do it.
And I think what's so fascinating too is like this kind of goes more broadly with antibiotics. Like a lot of them are like going to be more full spectrum, kill a bunch of different bugs. But one thing that was really interesting, I don't know if you've read this book, but it's called Missing Microbes by Martin Blazer. Again, he kind of talks more so like about how like Western cultures have lost like major species compared to like, hunter-gatherer populations. They have way more species of bugs in their guts compared to ours. And there's probably a number of reasons for that, antibiotics being one. So like one thing I remember him talking about in that book is like how like we potentially have the technology, or at least like the potential to target bugs, to be like, okay, this is like one strain of E. coli that we can really target, or like we can target, I don't know if they can do this, but like the bug that causes strep. Like they could basically start to fashion certain drugs that target certain bugs. But there's less money in it because like, if you have a broad spectrum antibiotic that covers a bunch of different conditions, like you're way more likely to use that. So again, like it was just an interesting conversation of like, we probably could develop things for specific bugs, but the problem is like the pharmaceutical companies don't want that because they'd much rather have like Cipro that can be used for like a bladder infection and a gut infection or traveler's diarrhea, or like they'd much rather have like these broad spectrum coverage for their drugs than potentially having like this drug is for this issue, this drug, like again, like have it be like more individualized, which is a bummer, but like it's kind of an interesting conversation. Like eventually do we get there where it's like everything becomes more targeted?
Hopefully, just maybe not in our lifetime.
Right.
Sadly.
Right. But yeah, it's like, I think again, like that's the unfortunate thing about like some of the antibiotics is I do think there's like some, there's profits to be made by antibiotics and that kind of scenario. And I think that's with research in general. Like research is going to go where the profits are at. So like even trying to figure out like, what feeds certain bacteria and see, like, again, like some of this stuff would be super interesting to study. It's just like, I don't know.
There's
like,
no money
right,
figuring out if like inulin inhibits E. coli or
right,
whatever it might be. Yeah.
Right. I know.
Yeah.
Well, that was depressing, huh?
Yeah, we're being kind of a bummer right now. I think, I think, well, it's not anything that people are unaware of, I think.
Right.
But, this is just the reality of
right.
the world we live in right now.
I'll say one last thing about rifaximin too.
Sure.
I mentioned it, but it is bioactivated. So like, I also think too, like if someone's having issues with like bile flow or like they know they have like gallstones or like some sludginess, I would not use, like I don't think it would work super well.
It's interesting. I wonder if they've researched it to see if it's less effective in people who have had cholecystectomy, gallbladder removal.
Right.
You would think, right? If it's bile activated and you don't get that like concentrated squirt of bile like you normally would,
Right.
you would think that it would be far less effective in people who have had their gallbladder removed. I wonder if they've researched that.
I don't think they have. I think theoretically, if that was present, I probably would try a different route, especially first, if like, you know, you were trying to figure out what to do. And again, honestly, I'd probably try other things first for gut stuff anyway than antibiotics or antimicrobials. Like I'd probably try baseline foundational stuff first.
You just segued us into our next little chunk for this episode, by the way. Mm-hmm. I know that this episode is about antibiotics. However, it's worth noting that antimicrobial herbs are not without their risks, and they are going to kill good bacteria at least somewhat. Like I get really exhausted like hearing people and like seeing people on the internet indicating or outright telling others that, oh, like antibiotics are bad and we should never use them. But here, have super high dose oregano oil.
Right.
Or like antibiotics are bad. Here, take a crap load of berberine every day. And it's like, we can't be that hypocritical. I mean, a lot of people are, but we can't be that hypocritical because anything that you're taking as an antimicrobial, like, again, you're not going to target it to that one bacteria that you're trying to target. You're going to have at least a tiny bit of collateral damage. Now, hopefully there's less collateral damage with herbs and like natural compounds. And hopefully there's like some synergy from the different compounds within the herb, right? So like there could be compounds in the same plant that kill the bacteria and inhibit the biofilm production and inhibit quorum sensing and disrupt their metabolism. So you might get multiple effects from the same herb, which I think is really, really cool.
Right.
But yeah, I don't want people to think that they could take herbal antimicrobials completely willy-nilly, because I have seen people get either overtly hurt by herbal antimicrobials or just they have gotten, you know, their gut symptoms have gotten a bit worse from too many kill phases with herbs. But like, especially higher dose berberine and higher dose oregano, I've seen many people, not many, but I've seen a good handful of people where they developed like really gnarly gastritis after one of those two. And it's almost always people who are doing really high dosing.
Right.
Like for berberine, for example, I might do like a 500 milligram capsule 3 or 4 times a day.
Right.
And that's kind of where I would hunker with berberine if I'm using it as an antimicrobial. But I've seen people where they were like, you know, I'm thinking of this one guy and he developed really bad gastritis after using berberine. And I asked him like, well, what dose were you taking? He was like, oh, I was taking like 4 capsules 3 times a day. And it's like,
right.
Okay, you were taking quadruple what you probably should have been taking. Holy crap. Like that's absurd.
Right.
And similarly, I've seen people where they've taken really high dose oregano oil and they've developed gastritis or they've developed like actually bad symptoms from that. And when I ask them what the dose was, it's something like absolutely astronomical, like Alison Seebecker level kind of stuff. And I'm just like, yeah, that's not good. That's not safe. Like, you're dropping an atomic bomb just like you would with a prescription antibiotic, and then you're thinking that it's going to be okay. I hate that we as like the internet, not you and I, but like I hate that we are leading people astray and making them think that that's an okay thing to do, and then they get hurt listening to that advice from the internet.
Right. And I think, again, unfortunately, we see this so much. Like, I think we see the overuse of antimicrobials broadly, whether it's an antibiotic or herbal antimicrobials, and then we're like dealing with the collateral damage of that with our clients across the board. And again, I think it's like always a good message to be mindful of how you're using these things and to not abuse them, and to like definitely think critically about how you're actually reacting to them versus like going through round after round, especially if you're not experiencing benefit. So yeah, I think it's such a good, important message. I know too, like with the antibiotics in general too, like I know we were going to like talk, but there's so many different weird, like nuancy things we could go down with antibiotics, right? I think like when would you take antibiotics? Because again, like antibiotics are life-saving. Like we don't want to like shit on them too much because again, like there's a time and place for them. Just like, again, like, I mean, PPIs, if there's someone that has a geyser of an ulcer, like PPIs can be like probably life-saving for that person. So it's like, I mean, I think that in the similar vein, like PPIs are over-prescribed. Sometimes antibiotics are over-prescribed. So you do want to be mindful with them. But again, there's certainly a time and place to take antibiotics. So I'd love to hear kind of like your tips on when to take antibiotics, or like what illnesses or like conditions might warrant an antibiotic.
Yeah, I feel like it's kind of a conversation of like, how high are the stakes?
Right.
Oftentimes that's a good framework to at least start with. So, well, one easy one. So I had to have antibiotics because of the surgery.
Right.
Now, I will say, I thought I was getting off scot-free and I wouldn't have to take antibiotics, because being a bit more hesitant to take them, I did ask my ear doctor at the pre-op appointment and at a prior appointment prior to that. I said, now, again, like I want to revisit this. We had talked about the pros and cons of taking oral antibiotics after a surgery like this. I said, I remember from when I had this surgery before, you basically fill the ear canal with Neosporin.
Right.
You fill it with goo. So since it's a very like localized area that you're working on, like, is that good enough? Like, could we just do the goo in the ear canal and keeping the incision behind the ear covered with Neosporin? Like, is there really a need to do oral antibiotics on top of that? And luckily, he's kind of a younger guy. He's like our age-ish. He's probably like my age, mid-30s. And, you know, so he seemed to be like fairly abreast on research. And he pretty quickly was like, yeah, you know, we used to prescribe oral antibiotics after this procedure, but like more recent research has indicated that it really doesn't make a difference in outcomes. Like there's not a lot of really compelling research suggesting that you need it. So if you want to skip the oral antibiotics, I think that's fine. So I was like, cool. Well, then I get to the hospital and they put in my IV and she gets a bag of something and she's bringing over a bag to hook up to my IV. And I'm like, oh, what's that? Thinking it's like fluids. And she's like, oh, clindamycin.
Right.
Like, oh, I thought I didn't need antibiotics for this procedure. And she was like, well, she basically said for any surgery, you need at least like the in-house antibiotics. And she said it's much easier to prevent an infection than it is to treat it.
Right.
You know, like if I got like staph or something weird in there.
Right.
So, you know, it's like in that moment, I wasn't going to be such a crunchy hippie person to be like, no, skip it, Susan. Like,
stop the IVs. You know?
Stop the IV. I'm leaving. Like, I already volunteered to come here and like let you cut me open. Like, okay, fine. I'll just take the clindamycin. So surgery, I absolutely would take whatever they give you in the hospital. If it's a more minor procedure like what I had, you could ask. And like, another way I'm thinking of it too is like they didn't cut like super deep into the tissues with me either. Right? Like versus if they were like cutting through a bunch of flesh to get to like my femur or my hip or something. Like that's a lot of cutting.
Yeah.
And a lot of like nooks and crannies where pockets of bacteria could hang out and get trapped and like or if
I always
it's
feel
like
go ahead, I'm sorry.
I was just going to say, or like a Grey's Anatomy moment where like if it's abdominal surgery and there's all of that, like the microbes in your gut, what if they nick your colon accidentally? Or like, what if they leave like the bloody rag in your abdomen and sew you back up like a Grey's Anatomy kind of moment? Right. So
you're going to create like some some intrusive thoughts for people as they head
True.
into
All right,
like
I'll stop.
Well,
But the point is surgery, take them.
well,
And you could always talk about, do I need to take like oral antibiotics after the surgery if it's a more minor procedure? And if you think like your doctor could have a conversation about that, you could do that, because that's what I did.
yeah, I think that's a good tip. It makes me think too, like I've heard a couple horror stories too about like orthopedic, and again, like probably these people follow the rules, like where they get like a replacement knee or like a replacement in there, and like I don't know if it's like whatever. I'm sure that whatever they use to like replace some of those things, or like a not robotic. What is it? Like they put metal and stuff in the
Yeah.
like some of those I think can get infected. We had a friend, my sister's friend's dad had like a really bad issue with like an infection post orthopedic surgery that was kind of like that, where he had like an artificial hip or something, like something weird like that was put in, and it like got very much like anything like that I think certainly could have higher risk for infection too.
Yeah. I think, again, like if they're really going in deep and cutting away at stuff, or if they're in an area where there's a lot of bacteria, so again, like in the abdomen where they're really
Right.
close to like the colon and stuff, I would take whatever they tell me to take.
Right.
It's not worth the risk.
Right.
Trying to skimp out on a couple doses of antibiotics and, just deal with the consequences later, I think. Similarly, dental work.
Yeah.
If your
I was just
dentist
gonna mention that.
tells you to take antibiotics, please, for the love of God, take the antibiotics. And it's less about like, oh, I don't want like the tooth or the gums to get infected. What can happen with dental work is some of the bacteria from the mouth can get into the bloodstream, and then it can make its way to the heart, and you could develop endocarditis if you're not careful. So I would always take an antibiotic if a dentist tells me to, because they know that that's a real risk of something that can happen, and I would just rather prevent it than try to treat it after the fact.
Right.
But that's one that I have a lot of people question. I've had
for
many
sure.
patients who are like, hey, I have to get some dental work done. They say I have to take antibiotics. Do I really have to? And I'm like, yes, God, yes. Like, please.
Right. Yeah, I think again, like I could totally understand the question of like, is this really like needed? It's just like in my mouth. Like I could totally see why someone would question it, but I think you're right. Like for that particular situation, the risk doesn't outweigh the benefit. At least in my mind, and I think in your mind too.
Yes.
What about like with certain illnesses? Because I think that's where it gets a little weird, because I do think sometimes doctors are like, oh, you have an infection, and it's like, but they don't culture stuff. Like that's the thing that kind of blows my mind with some doctors is like they don't culture things, and then it's just like, well, that was a fungal infection, or that was like a virus that you just threw antibiotics at that might be preventing that person from actually getting better. Like it might just extend the length of time that they need to get better. But yeah, I think that's always like an interesting question. And that could be like almost case specific too, like depending on like your symptoms, like the severity of things. But again, like I think like sinus infections, like ear infections, like sometimes there's some squirreliness there of like what microbe could be involved. But yeah. I know you've had more sinus infections. I've had a ton of ear infections. We both have had some weird squirreliness with the ears, but
I think the majority of my antibiotic exposure growing up was because of ear stuff, either the surgeries or ear infections. And certainly like in the 80s and 90s, the thing to do was just to give antibiotics. And honestly, I think it's still the thing. I mean, anybody right now, if you have a kid and, they've had ear infections, like tell us in the comments on YouTube, like, do they still prescribe antibiotics like super easily for ear infections?
Do, because my sister has a son and he's had multiple ear infections, and I'm pretty sure he's on like the bubble gum antibiotic that tastes pretty tasty. If I remember right, I like the bubble gum. I don't know if it was like amoxicillin.
I hated the grape. Like
Oh, yeah, I didn't
Dimetap,
like
grape Dimetap.
Oh, God.
bleh.
Well, and
Barf.
with the ear thing, remember like my weird yeasty ear thing? You remember that? So interestingly enough, so when I was like around 1, I had like an ear infection that just would not go away. And they literally prescribed like antibiotic after antibiotic after antibiotic. And like my mom said they were like not sure what to do. And then like finally the last round of antibiotics did something. And maybe it didn't. Maybe it was just like, I don't know, something shifted in the ecosystem outside of that helped. But I often wonder if like, was it a bacterial infection? And that's just like why not, and maybe it was some other type of infection. That's why like none of the antibiotics worked. And you had to cycle through like 5 different antibiotics to get the ear infection under control. Like, so I wonder sometimes about situations like that during my life where it was like, oh my God, like that was probably a pretty critical like period from a microbiome development standpoint that I just got like 5 rounds of antibiotics back to back to back because my ear infection. But it's like, what, did I have like a fungal infection back then? Who knows?
Yeah. Yeah, I wonder. Yeah, and I'll say this statistic, I've never bothered to fact check it. So this could be internet rumor, hippy dippy bullshit. So keep that in mind. Try to verify it if you're really curious. But I know I've seen stuff on the internet suggesting that like 90% of ear infections are viral in nature. They're not bacterial.
Let's look. I'm
which
gonna look
then,
it up.
which then suggests that 90% of the time we're prescribing antibiotics unnecessarily in the cases of ear infections.
Right.
I think too, like eardrops work reasonably well. I mean, there's probably studies comparing like eardrops only versus eardrops plus oral antibiotics versus antibiotics only. But like they have antibiotic eardrops. I have to start using them tomorrow in preparation for my post-op appointment. And it's like, if you can keep something topical, you know, it's kind of like the equivalent of, do you use like a little bit of a topical steroid for eczema or do you take an oral steroid? Like, obviously it's better if you could stick with topical and just keep the pharmaceuticals localized so that you don't have to deal with that burden.
Yeah, I agree. This is interesting. This is from Harvard. It's like an article.
Fairly reputable.
It's from an article. It says, acute ear infections are the most common infection for which antibiotics are prescribed to children, which is interesting. But I think super common. However, roughly 80% of children with acute ear infections get better without antibiotic treatment. So, again, like, super interesting. And again, like, it's always hard to know. Like, it might be a play it by ear scenario. Like, you know, do you have to rush to do the antibiotic? Like, could you kind of wait it out and see kind of how they're doing? I think, again, like, you almost have to make judgment calls as a parent all the time with that kind of scenario of like what makes sense in the moment.
Well, and ear infections are truly miserable for all parties involved.
Right.
Like
100%.
There are few hells on earth like a kid screaming all night, pulling at their ear, and like you're terrified, they're in pain, you haven't slept in 2 days. Like, it's a really stressful thing. Oftentimes ear infections are not simply like, mommy, my ear feels funny. It's like,
right. That's like, I remember I told my sister, I'm like, Cece's like pulling at her ear. Like, does she have like an ear infection? My sister's like, oh no. Like, you would know if it was like, you know, an infection. She'd be pissed. And I'd be like, okay, I'll just like keep moving on. And she was fine.
Yeah. So for ear infections, generally speaking, I would be hesitant to do antibiotics. Now, there are alternatives, like chiropractic adjustments can help, presumably because like aligning the neck properly will help like the eustachian tubes drain more effectively into the throat. But I know many pediatric chiropractors who swear by that up and down. The key is to find somebody who knows what they're doing with pediatrics.
Right.
I wouldn't just go to like Joe Chiropractor down the street. And I say this as a chiropractor who does not adjust children. So keep that in mind. But if you look up, I think it's ICPA 4, the number 4U.com is the really cheesy URL for the pediatric diplomate program. And you can look up people on that website. They have a locator.
Yeah, I think you told me that. And that's where I found ours for CC. And what's interesting about it is like, there are very few people in my, like, it was like 5 people. And like, there's chiropractors everywhere here. So it's like, it is funny because a lot of them are like, oh, we see kids, like we do this and that. But they don't have like that official training.
I would not go to somebody unless they're certified through that program personally. And again, I'm a chiropractor.
Right.
But like no. So yeah, there's that option. There's Herb Farm. So HERBPHARM is the brand. Herb Farm makes a garlic, mullein, like olive oil, like infused olive oil for this. And a drop or 2 or 3 of that in the affected ear can really help. I don't know exactly how or why, beyond like garlic as an antimicrobial kind of thing, but the garlic mullein drops are wonderful. And then in more recent years, I heard from another friend who also had weird ear problems growing up. She learned from her ear doctor that a couple drops of fresh peroxide in the ear and let it sit for like, a couple minutes and then drain, that can also work wonders. The key is you want it fresh so it actually does like the fizzly bubbly thing.
Right.
And like tell your kid that it's going to feel really weird, but it's okay because it's going to feel like you just poured soda in their ear.
Right.
Yeah, so those are options as long as they don't have a hole in their eardrum like I do. And they make cheapo otoscopes and cameras and stuff. So you could get one of those on the internet just to take a peek and verify that the eardrum is still intact.
Right.
Or you could take them to the doctor, verify that the eardrum is still intact, and then you could start either of those treatments. So yeah, there are some options. The one infection, like the one common infection that I would take antibiotics for probably is strep throat. I feel like for me, kind of my comfort level is maybe like the first day I would be open-minded to like, okay, let's try some oregano oil or like the biocidin liquid or something like that. If you get to day 2 though, and it's not budging, it's not getting markedly better, I would absolutely go get a proper strep test and take whatever antibiotics they tell you to take, because strep throat can get real weird real fast if it's not treated. It's not worth the risk. Like pandas kind of stuff, it can lead to like autoimmune weird funky stuff with the nervous system. It's just not worth doing the do-si-do with if you don't have to.
Right.
So again, personally, strep, I would maybe give it 1 day of trying the natural stuff. In the day 2, if it's not markedly better, I'm pursuing the antibiotics.
Right. Yeah, I remember like when Armand and I were dating, he had strep throat. I don't know how I did not get it, but like he had strep throat and he was such a little baby. But like it took him a while to get diagnosed. Like he just like was like, I'm fine. And then like literally he went to the doctor and they're like, oh my God, you have like trademark like white patches all in the back. So nasty. But yeah.
Oh, Armand.
I know.
Oh, Armand. That silly goose.
He is a silly goose.
Yeah, that's a case where I would just suck it up and take the antibiotics.
Yeah.
I think like for upper respiratory stuff, I'm just going to choose to ignore the whole COVID pandemic for a moment. Because I feel like that just complicates stuff.
Right.
Like, I don't even know if I could speak to like COVID and its complications.
Right.
Obviously, if you only have COVID and like nothing else, you wouldn't need an antibiotic for that. But if you had pneumonia secondary to a COVID infection, like I would probably take antibiotics for that, right? Like pneumonia is one that I feel like I would probably take something for personally. But if it's like, oh, I have this like very mildly annoying kind of lingering cough and it's clearly not life-threatening and it's clearly just like a nuisance, I probably wouldn't take anything for that either.
Right.
And I think I might have shared my story couple years back. Well, it was probably like 6 years ago or something. No. Whenever Jess went to preschool and we were exposed to the preschool germs, it was intense. And we were sick for like 3 months. And I had this lingering cough that would not go away. And it was just really annoying. And it wasn't going away for like 2 months. And my mom basically like scared/guilted me into going to urgent care. And so I went in and I told the nurse practitioner, I'm not even joking. Like, we had a come to Jesus moment, Amy. I was like, listen, I'm here for your medical opinion. I want to make sure I don't have pneumonia. If you really, really think I need antibiotics, I will take them.
Right.
However, I want you to know I'm not here like being a pill seeker. I would be perfectly fine walking out of here with nothing. I have a history of IBS. I really don't want to mess with my gut microbiome if I don't have to. But again, I'm here for your medical opinion. If you really think I need antibiotics, I will take them. And she did the most half-assed physical exam ever. She listened to each lung once, which is woefully inadequate. She listened to each lung one time and then kind of just like did one of these and was like, okay, yeah, so I'm going to prescribe you doxycycline and here's the script and here's how long you take it for, 10 days. And then I asked her, I was like, ooh, okay. I was like, all right, sometimes if I have antibiotics, I'll get like a vaginal yeast infection. I would rather not do that. Do you think you could prescribe me like a dose of an antifungal to take with it just to get ahead of that, just in case? You would have thought I asked her for 8-ball crack cocaine.
Right.
Like, she proceeds to lecture me about how, well, these are very dangerous drugs and they can make your liver enzymes go up. And I can't believe you would ask for that. And are you really sure? And I really need to advise you against it. And here's all the other stuff that can happen. And I'm like, you're giving me doxycycline like they're Skittles.
Right.
And you have absolutely no problem with giving me doxy. But then a single day's worth of whatever it was, fluconazole or whatever, like a single day of an antifungal, one pill of an antifungal, and you act like I'm going to die instantaneously from that. Like, can you please get a grip?
Right. It's ridiculous.
Anyway, fast forward, I later figured out that she had officially diagnosed me with viral bronchitis, which is a self-limiting viral infection that was going to go completely away all on its own without the doxycycline. So I had taken one dose, found that out the following day, and then I said, screw this, and I just put the rest of the doxy in my medicine cabinet and saved it for a rainy day, because I'm not going to take a full course of antibiotics for a freaking viral infection.
Right.
But what drives me crazy is I tried to communicate very clearly and very like I was cool, I was nice, I was not like a jerk to her or anything. I literally just told her, I don't want to take antibiotics, but if you think I really need them, I will. Like, I'm not going to be an uncompliant patient here. But like, I even tried to have that heart-to-heart come to Jesus moment with her and spare my microbiome. And she still couldn't get out of that like autopilot brain mode of like, oop, everybody gets an antibiotic. Right. And this was in like 2018 or something. So it was definitely in modern times.
Oh my God. Yeah.
Cleansing breaths.
It's wild. It's wild. It's the Wild West out there. Well, I feel like we've talked a little bit about that. Do you have any other, like, again, I think sometimes it's like dependent on like the exact like sickness, but I feel like we covered like some of the biggies that like are really common. Yeah. I mean, I think like really deep infections, like a kidney infection. Oh, 100%. Yeah. Or like bone infection, like, you know, like that sort of really stuff. Bad UTI or something. Maybe, yeah, I might be inclined. Again, like with UTIs, I would try the natural stuff like the uva ursi and the D-mannose. I would definitely try that initially for the first like day or two. But if you're not turning a corner after like a day or two on that stuff, then I would
would get looked at. Because, yeah, it could turn into a bladder infection, and then that turns into a kidney infection, and that's really bad.
Right.
So, yeah, that sort of stuff is a maybe. I've had pretty good luck not licking. You know
licking
what I mean,
your UTIs? Is that what
licking a UTI. Yeah, exactly. That just came out way weirder than I intended it to be. I do think that most UTIs could probably be knocked back.
Right.
And I will say I wouldn't take an antibiotic for a UTI unless I had like a positive urine culture.
Right.
Because sometimes what feels like a persistent UTI is actually not infectious at all. And it's interstitial cystitis, and like you don't want to take antibiotics unnecessarily for something like that.
Well, and I think that's a really good point, like trying to push for culturing when possible versus just taking like taking antibiotics based on like your case, like what the doctor, because I think again, like some doctors are just like, oh, it sounds like a UTI, take this antibiotic. And it's like, well, at least like do the urine. But if you're doing like a telehealth appointment or something, I don't know. Like sometimes I feel like, especially during COVID times, it was like, oh, just try it. It's like, we don't want to see you in person. So again, I think when you can try to culture it just to like make sure it's a bacterial issue.
Well, or like with my story going to urgent care, I was really hoping, like, again, trying to rule out pneumonia.
Right.
And I had that cough for like a month and a half or something at that point. Like I was really hoping she would just do a quick chest film.
Right.
Like do a quick chest x-ray. And then and like, I was also hoping that she would listen to my lungs in more than one place each. In school, they taught us 7. You're supposed to listen to 7 locations on each lung.
Oh my God.
Total of 14. So, like, I think that she was very much in the mindset of yeah, all right, you're just like no critical thought, no.
Doesn't give a shit about her job.
Yeah, doesn't give a shit, just burned out. Like, I hate my life. I hate being here. I hate urgent care. Get out of my hair.
Right.
And move on. But, yeah, like try to pursue a proper workup if you think there's a possibility. Like if it's strep throat, maybe like get a throat culture. We had a scare a few years ago. I was pretty convinced that Jess had strep throat. Mm-hmm. And I was giving her, I think I had like some of the liquid biocidin at the time. Mm-hmm. And I gave her some of that. But we went and got a culture just to be sure. And even the doctor was like, oh yeah, this is probably strep throat. And I think what they did was they wrote the prescription for the antibiotic right then and there, with the assumption it was strep. And then they like sent us home, and the next day when the results came in, it was negative. So we were like, oh, okay. Like, I'm really glad I didn't give her the antibiotics under the assumption it was strep. And sure enough, like within a day or 2 or 3 after that, she knocked whatever it was out, and like she was fine after that. But I think trying to pursue like a proper workup, a proper diagnosis, and like frankly not letting your doctors be lazy. Right. That's going to be the best thing to do, I think, and just like try to use your noodle and try to like question whether or not it's necessary or whether or not skipping the antibiotics could do a great deal of harm, like with the dental work or like a bone infection or a surgery or something like that. Right. One more to kind of maybe like start wrapping us up a little bit is anything tick-borne.
Okay. Oh, yeah.
Anything tick-borne, please, for the love of God, just take the antibiotics and be done with it if you're sure you have it. Right. So here's the 2 sides of the coin here. If you have for sure Lyme disease or, Bartonella or whatever it is, and like the diagnosis is very clear, especially if it's acute, if you've got like the bullseye rash and Bell's palsy, like the stuff that I had, for example, take the antibiotics, be grateful that they exist. Do not do like the lavender essential oil or whatever it is for the resveratrol for the Lyme disease, like just knock it out. I will say though, people in the functional space, I think overdiagnose Lyme disease out the wazoo. Yeah. Like IGeneX. I used to occasionally order like IGeneX labs, for example, for Lyme disease, and I don't anymore because I actually think they're overdiagnosing the crap out of Lyme disease. Yeah. Like they're their diagnostic criteria seems too loose.
Yeah.
And there's too much overlap. Like some of the markers that they test, like if you look them up, they're like, oh, well, that could be Lyme disease, or it could be like Epstein-Barr, which practically everybody has had and everybody carries in their body. But like, we're going to tell you have Lyme disease. So I don't super trust the functional tests for Lyme disease anymore. And I don't think that is enough to convince me to go the antibiotic route. But if you had like LabCorp or Quest or like a spinal tap like I had, if you had something where it was like pretty definitively Lyme disease and you have the classic symptoms, or if you have something tick-borne and you know you have it, I would absolutely take all the antibiotics. I would take extra antibiotics. Heck, take whatever they will give you and just be grateful that they exist at that point. But that's one that you really don't want to mess with it. If those infections become persistent, they just do such weird inflammatory stuff in the body. You don't want to deal with that headache.
Right.
Not worth it.
Good point. I think the only other thing I'd add, if you do take antibiotics, like I think really ensuring that you're continuing to eat a diverse diet while you're on the antibiotics, potentially doing some supplemental prebiotics, I think can be very helpful to try to kind of maintain stability, as much stability as you can in your microbiome, like through being on the antibiotics and then kind of coming off the antibiotics. So I think, again, like that's something to keep in mind. Maybe potentially eating, like continue to eat like fermented foods or take some probiotics if that feels good. But again, I think like probably the biggest thing would be dietarily eating lots of prebiotics, which is so funny because like with the Rifaximin conversation, like how many doctors are like, eat shit, like eat whatever you want, like feed the bugs, you know. Same thing with like the Pimentel thing, like mindset. It's like, you know, it's like, you know, feed the beast. And it's like, no, like you don't want them eating a bunch of trash while they're on this antibiotic. Like you probably still want to be eating, not that you have to eat like super clean, but like you probably still want to be eating a lot of like fibers and prebiotics to try to feed the good bugs while you're on an antibiotic to try to preserve the microbiome as best as you can.
Yeah, I think just trying to focus on eating reasonably healthy.
Right.
Again, like I don't know if you need to go like full on keto because sugar is the devil, but like maybe don't overdo it on sugar. I say that though, and I will say it was my cousin's birthday. So like several times since I had my surgery and my round of antibiotics, I have had several pieces of cake, and I would not change that for the world. And I have had several pieces of chocolate. So like I haven't even...
I feel like it almost becomes like, I think you need to be getting the prebiotics in, like more than, like if you're getting the prebiotics in and then also having some sugar, I think it's less problematic than like if you're just eating kind of like not optimally and a lot of sugar. So like to me, again, like having some treats here or there, I think is like less problematic if like 90% of your diet is pretty solid.
I agree. Well, it's like it's all about diversifying the bacterial microbiome and like building that back up.
You were eating chocolate cake and chocolate, it sounds like.
Yes.
So like you were getting polyphenols.
So many polyphenols.
Yeah.
So many. Totally worth it. And like we have these little like slightly more natural like Mounds Bar treats. I forget. I think Unreal is the brand. And like coconut, that'll have a teeny bit of fiber, right?
Right, there you go.
I don't know, like we're gonna go with it. But yeah, I think it's if you're eating like a standard American diet where it's low in fiber and high in simple sugars and high in like unhealthy fats and like heavily processed, devoid of polyphenols, devoid of color, that's going to be most problematic. But you're right. If you have like, you know, like I told you what I was eating post-operatively. I was having lentils and rice,
right,
veggie lasagna that has a bunch of different vegetables and a crap load of garlic in it. So I'm warding off the vampires and feeding my microbiome with tons of FODMAPs. You know, I was having different, like we had a soup that's like potatoes and kale and like garlic and another soup that's like a chili with a bunch of beans and meat and tomatoes. So I was getting a lot of good nutrition and fiber and colors and variety in my diet. And then also I had like some treats. So
Right.
I don't think that's a huge, huge deal.
Right. Yeah, no, I don't either. I think you were covering
That's
the
my
bases.
story. And I'm sticking to it, darn it.
Yeah. Yeah.
Because I've said on this podcast before, you're going to take my chocolate from my cold, dead hands and not a moment sooner.
Yeah, I
So
agree.
I'm going to tell myself those polyphenols are good for me, darn it.
They are. I've been eating way worse. Like, honestly, just the fact that I need to eat like 3,000 calories to produce milk, it's like, honest to God, it's like if I'm eating chocolate every day just to like help that process, it is what it is. Like, it's like it's so hard to get through that. Again, like, it's an everyday struggle. And like, some people be like, oh my God, that's so awesome, you can eat that much. Blah. And I'm like, no, you try to eat, like, shovel 3,000 calories into your gullet every day. And then, like, if you miss a few days, you just feel like crap. Like, again, like, for me, it's so strange. Like, if I miss a few days, I just feel like crap. And I'm like, what's going on?
Because your body's not going to sacrifice the milk. Your body's going to
Right.
sacrifice you and your
Right.
function and your
It's
energy,
crazy. It's like, again,
which is so rude.
yeah, it's like, oh, okay, like, the day only got 2,500 calories. Wah. And it's like, it's just wild how the body's like that. But yeah, I think, like, again, it's so interesting. But yeah, I think I've been shoveling in more sugar than typical postpartum, just because, like, getting that many calories in is so challenging. Armand came home with a gluten-free pizza that was like an individual pizza instead of like the medium pizza that I typically get. And I swear I almost divorced him. I said, you're going to need to get me, Mama needs a medium pizza. Again, I might not eat the whole medium, but I need more than the individual pizza.
Yeah.
I'm like, don't do this again. You know, like, my boys go, like, it's,
Or else. I know where you sleep at night.
I know. So,
Oh, Armand. Oh, Armand. Again, silly goose. Silly
Yeah.
goose, Armand.
I know.
Oh, goodness. Well, oh, shoot. I have one more academic thing to share about the antibiotics,
Okay.
if I may, and then we can wrap up. Because per our usual, your boob is probably ready to explode. Singular, just the one.
Yep.
But I looked up because I've always had this question, and I had this question after my surgery and my one bag of clindamycin. I've always kind of wondered, like, all right, do IV antibiotics disrupt the gut microbiome a ton, or like, do they
Right.
disrupt it a ton? Right? Because like, it makes sense that something that you consume orally and it's going to be in direct physical contact with the microbiome.
Right.
It makes sense that that would nuke the microbiome. But maybe if it's floating around in your veins and it's not like saturating the lumen and the epithelium,
Right.
like maybe it's not as detrimental. And selfishly, I was curious because I had the like 6 or 8 weeks of IV antibiotics when I had Lyme disease. So
Yeah.
again, I'm just like, how bad was that really?
Right.
So I looked it up a little bit more to try to get a more definitive answer. And the long and short of it is, yes, IV antibiotics definitely do something to the gut microbiome.
Right.
If it's short term, like what I had, like 1 dose in the hospital, it's probably super minor and super transient. Like a couple of the research studies I found on this were looking at premature infants in like the NICU. And they basically were looking at like infants who had no antibiotics or short-term or long-term antibiotics like in the NICU. And they
Right.
were kind of following the microbiome. And again, it seems like compared to the control, like short-term use, just like a day or 2 or 3 use, pretty minor changes, and like the microbiome stabilized almost right away afterwards. Longer term had more detrimental effects. Some studies suggested reduction in diversity, which isn't surprising.
Right.
Some saw like decreases in bifido or decreases in particular bacteria. Similarly, there wasn't a study on horses, and they were looking at different IV antibiotics, and it seemed like they reduced alpha diversity, but again, they only did like 5 days of treatment, so the results were fairly short-lived, and then the horses' microbiomes recovered. This one was my favorite of the studies I found, though. So it was a mouse study, and they were trying to determine if the route affected the microbiome differently. And they did say this. They said significantly less or delayed development of antibiotic resistance in the GI tract of the antibiotic-resistant carrier inoculated mice was observed when the same doses of antibiotics were administered via IV rather than oral administration. So I think my hunch was correct in the sense of like something orally administered where it's in direct physical contact with the microbiome. That's probably a bit more detrimental to the gut microbiome. But if you have IV antibiotics, like I have had several times in my life, you're not off the hook. Like that's going to do something to the gut microbiome. It might not be as bad as like, again, I'm picturing like I had the 6 or 8 weeks of IV antibiotics for Lyme disease. That was probably slightly better for my microbiome compared to like the people who take 2 months of doxycycline for acne. Right. So it's like, at least it was a little bit better than that, perhaps, for me. Sorry to all the people who have taken doxycycline for acne. Oh my God. Acne is one that I would absolutely not take antibiotics for. There's so much else we could do for acne. And again, like the doctors, it just seems like it's lazy medicine. Like, we'll try like this and maybe one other drug. And if you don't respond to these like 1 or 2 other drugs, Accutane and maybe spirulactone or something. Right. Like if you don't respond to one of these 2 things, just boom, take doxycycline literally forever. That's fine.
Yeah, that's so interesting. I remember like I had a lot of like acne pop up post or like right before my gut issues really surged. And there's definitely a link between like where my gut is and my skin typically most of the time. Not always, sometimes it's more hormonal, but like I remember going to like a nurse PA at the dermatologist and like, again, my acne wasn't even like that bad. And she was like, oh, like I think like a low dose antibiotic, like she was like all in it. And I'm like, this day and age, like this was like maybe 9-10 years ago, like this day and age, you're just gonna like put me on an antibiotic. Like again, like it was even shocking back then.
Still happens all the time.
Right. I don't get it. What?
I've had 2 patients who specifically developed C. diff infection.
Oh my God.
Because they had been on both of them doxycycline for a year or 2 or more for acne. And then something came along and they had a case of the sniffles. They had like a sinus thing and they had to take, 1 additional antibiotic because of whatever the sniffles was, like they had some upper respiratory thing and they got prescribed another antibiotic and they took it and then whammo, that was just enough that they got C. diff. But again, like you wouldn't have gotten C. diff had you not been on the doxycycline for several years prior to that. It's just absurd that that's a thing that's still done. But I saw both of those people in like the last 4 years. So I've had other people where like they have mentioned that they were on longer term antibiotics for acne.
Of those. Yeah.
Yeah. Like I've seen a lot of people like that. I think I've only seen 2 that specifically got C. diff and like could directly attribute it to acne antibiotics. But yeah, it still happens all the freaking time. And I do not understand. I thought that we had progressed as a society. I thought that we knew that overusing antibiotics was a bad thing.
Right.
But apparently not everybody got that memo.
Right. Even if like you're trying to prevent like the big things like C. diff or like antibiotic resistance or, like even some of the biggies that you wouldn't want that are like more prevalent than even just like the
let alone all the
effect.
stuff we talk about.
Right.
New idea, by the way. New idea.
Oh, God.
We are going to quit the podcast. This is the last episode. Not really. We're going to quit the podcast. This is our last episode because you and I are going into business together. You want to know what the business is?
Are we going to like run into like dermatologist office and like spray paint the walls. Like, we're going to be like activists, like, stop prescribing antibiotics for acne, and then fly out.
That could be the other half of our business.
Okay.
We could have multiple ventures here. No, what I was thinking, so we learned this back in the day, I don't know, like the 90s and like the early 2000s. There were people who made businesses out of basically being spammers to fax machines. So these people would have like a database of fax numbers for various businesses and establishments. And this guy that we knew like painted the story. He was like, yeah, I knew a guy who did that. And like, he literally, his business, he just had this giant room full of fax machines and like a list of fax numbers. And you would just like go around, or like the employees would go around, and you send the same document, like a flyer for the whatever,
Right.
like a flyer for this product or this sale or a seminar, whatever the people wanted to advertise, you know, the people who like pay you
Right.
and say like, please spam this to everybody on your list, please and thank you. Like, you know, you would just send that document to all of the fax numbers on your list, and you would just keep like running it through this room full of fax machines. So what we could do is we're going to buy a bunch of fax machines, and we're going to fill a room with nothing but fax machines. And then you and I and Mike and Armand and like Cece and Jess, yeah, we can train them too. We're just all going to have, like, each person can have like 3 fax machines, right?
Right.
And then you're just like feeding it through, and we're going to have bulletins. For the love of God, please stop overusing antibiotics.
Right.
There are other options. And like, you know, we could have one that we send to all the dermatology offices.
Right.
We could have a variant that we send to like all of the urgent care offices. We could have one that we send to other
My idea
offices.
was like that, but a little bit more in your face. Your idea is a little more subtle.
Mine is like slightly sleazy business. Like, we're just going to get all their fax machines and just spam them nonstop until they can't take it anymore.
You're more passive aggressive. Mine's just more aggressive.
Yours is something that could land us in jail potentially.
Right.
So we've got to be like slightly careful with your idea.
Yeah.
True. Mine, we're going to annoy the crap out of people, but we might get through to some people, and we might make a lot of people change their fax numbers.
Yes.
So, you know, but I think it's a pretty good business. We just have to come up with a name for our business. If anybody's still listening to this part of the rambling message, go ahead and leave your comments below on the YouTube video. What should we name this business that we just made up on the fly? And we're gonna go forth into the world and convince doctors to not overprescribe antibiotics, because OMG, they're still doing it left and right. It's a big problem. Keep your wits about you. Leave us your ideas for names for this business, and we will see you in the next episode.